Hello, I'm Errol Crook. I'm a physician at the University of South Alabama, where I hold the position and title of the Abraham A. Mitchell Professor and Chair of the Department of Internal Medicine. I'm also the Director of the Center for Healthy Communities. I'm here today to talk about coronavirus in our communities in Mobile, specifically with a focus on underserved communities, those that have a proportion of poverty and a higher proportion of African Americans living in those communities. Nationally and locally, we've heard of data that talks about the fact that African Americans are at higher risk for getting severe infections with coronavirus and having a much higher risk of dying. These data are true, and we want you to take them very seriously. It is important that these are taken to heart, and that you pay heed to the things I'm going to be talking about as we go through this in an effort to save your life and your loved ones. The symptoms of having an infection of COVID-19 are typically fever, cough. That cough is usually not productive of any sputum. Aches and pains throughout your body. We have several people who have gastrointestinal complaints, so nausea, vomiting, and abdominal pain. Headache is also one that is often said. If you have those symptoms, you should contact your primary care provider and ask them what their recommendation is. In many cases, they will ask you to get tested. They usually will not ask you to come into the office. They will send you to a testing center so that you can reduce the risk of yourself and other patients of contacting the virus. But hopefully we can get you to a testing site where you can get your results back soon. If you're someone who has been notified of having the virus, but you are not very, very ill, you won't need hospitalization. You should stay at home. You do your best to isolate yourself away from the rest of your family, and you do supportive care, things such as having enough fluids, taking Tylenol for headache, making sure you're eating as healthy as possible, maintaining your social distancing from other family members. If you are alone, you need to have someone who's going to be checking on you every day. Coronavirus can lead to a sudden worsening of symptoms, particularly with shortness of breath. And if you get to that point, you need to seek health care urgently. That is the warning sign, the definite signs of shortness of breath. You need to seek health care urgently. It is still best to call your primary care provider first, so that if they direct you to the emergency department, they can call ahead and they're ready to receive you. So what can one do to prevent the spread of the virus and to prevent catching the virus? We've all heard the term social distancing. That is going to remain incredibly important. Staying away from crowds, not creating crowds, staying in your home as much as possible, cleaning in the home, particularly surfaces, and particularly those surfaces going to be touched very often, like doorknobs and remote controls, telephones, countertops in the kitchen and bathrooms, faucets. Clean those a few times a day. But most importantly, wash your hands. Wash your hands with soap for 20 seconds. And do your best not to bring your hands up to your face. Wash your hands every time you think about it, before you eat, after you eat, before going to the bathroom, after going to the bathroom, if you cough or sneeze, if you rub your nose, or if you just haven't washed them for a while, wash your hands for those 20 seconds. That is incredibly important. The other thing that is important is to have a mask. Use it when you are outside and moving about to go to the grocery store to do those necessary activities. Even if you're inside the home around each other, it is good to wear it. The mask helps in preventing you from spreading the virus to someone else, way more so than it prevents you inhaling the virus particle. So having as many people having a mask is important. When you go out into the grocery store, to other places of necessity, wear your mask and stay 6 feet apart from other individuals. And again, wash your hands.